Thank you for joining us. I'm joined by Maggie Krell, Chief Legal Counsel for Planned Parenthood Affiliates of California today, and we're here for a very important announcement. But as I said, it's important for us to note that 18 years into the 21st century, it may be hard to believe, but we're still having to fight to protect the rights of women to have access to the health care that they need. Maggie and I are here today, and we're joined by so many others throughout the country to protect something very important to all of our families, and that's Title X of the Public Health Services Act of 1970. It's the nation's only family planning program in America. For decades, women and families have used Title X to access cancer screening, family planning services, including birth control, and many other programs. Indeed, Title X is a critical lifeline for some 4 million Americans in this country and around 1 million Californians. But back in February, the Trump administration released a new set of requirements for Title X funding. By changing the rules, the Trump administration is threatening basic access to essential health care for women and families throughout the country. That's why this morning, the state of California is leading a coalition of 19 states and the District of Columbia in filing an amicus brief in the D.C. District Court for the District of Columbia in supporting a nationwide preliminary injunction seeking to block this harmful rule change to Title X. I'm here with Maggie Krell, and we're standing with several organizations that took the Trump administration to court earlier this month. Those organizations include Planned Parenthood of Wisconsin, of Ohio, and of Utah, and it includes the National Family Planning and Reproductive Health Association, which represents all family planning providers. The Trump administration's new requirement essentially favors facilities that limit medical care and restrict patients' choices, especially for women. Many of these favored facilities do not provide women with fact-based health information or comprehensive health care. Some of these facilities that are favored by the Trump administration don't meet the Center for Disease Control and Prevention's clinical quality standards. That won't fly in California. These new requirements will harm our state, which has the largest Title X program in the nation. In our legal brief, our coalition argues that the Trump administration's policies change that they're making to Title X is a conflict with the underlying Title X law. We also argue that their change violates the Administrative Procedure Act, which bars arbitrary and capricious agency actions. And we argue that the change improperly makes an addition or a change to or amendment to the nature of Title X funding. Our brief also highlights the importance of Title X to so many states around the country. We assert that Title X has been a vital source of funding for our healthcare providers, for our state's public health efforts, and for the residents of our various states. Unfortunately, these new requirements are not the first attack on women's health by this administration, nor do I suspect will they be the last. California will defend a woman's health care rights, and we will stand up to any and all attacks on women's reproductive rights. Our record speaks for itself. We stopped the Trump administration from rolling back rules that aim to deny women access to birth control, and we continue to defend the Affordable Care Act in federal court. We're ready for this fight too. With that, it is now my pleasure to turn the mic over to Maggie Krell, Chief Legal Counsel of Planned Parenthood Affiliates of California, and, I should note, an outstanding former prosecutor at the California Department of Justice.
Good morning. Thank you, Attorney General Becerra, for your unwavering commitment to ensuring access to reproductive health care for all Californians. My name is Maggie Krell, and I'm the Chief Legal Counsel for Planned Parenthood here in California. Earlier this month, Planned Parenthood filed suit against the Trump-Pence administration in federal district court to fight against its attempts to undermine the Title X program. Title X is the country's only initiative dedicated to reproductive health care services. Nationwide, 4 million people rely on it every year for affordable birth control, STI treatment and prevention, cancer screenings, and other life-saving services. The administration has made it clear that it intends to restrict, if not eliminate, access to reproductive health care. They issued a rule to allow employers to deny birth control access to their employees. They ended protections for sexual assault survivors. And over and over and over again, they've attempted to block patients from entering the safe doors of a Planned Parenthood health center. Not only is what they're trying to do illegal, but it would have devastating consequences for patients and could threaten health care for millions of people. So Planned Parenthood went to court to stop them. We believe all people deserve access to health care, regardless of who they are, where they live, what they look like, what their race is, what their sex is, what their immigration status is, or how much money they make. That's our moral obligation. We will not stop fighting for birth control and evidence-based reproductive health care for everyone, including the 4 million people in this country who rely on Title X.
We want to thank you all for coming by, and have a great day.